Hi everybody, welcome back. Today we come to you from the National Center for Plastic Surgery, Jackie and I. We welcome you back to week 2 with Breast Friends, and today we are going to be talking about the different treatment options during your cancer journey. So to start off this video today, I'm going to let Jackie introduce herself again, and then I can introduce myself.
I'm Jacqueline Sweet. I have been a clinical esthetician now for over 16 years. I was in dermatology for over 10, 11, and then I came over here to plastic surgery about 4 years ago. I became a certified oncologist esthetician in about 2010, 2011, and that's one of the reasons that I came on over to National Center for Plastic Surgery. Our practice works with 85% of our client base, patient base, is oncology for breast reconstruction, for breast cancer. So Emma and I had the opportunity to work with such a great community.
Exactly. And I'm Emma Claire. This is my 3rd year of doing aesthetics, medical aesthetics in this field, and I am new to the National Center for Plastic Surgery. I started last December with Jackie. She's been a great mentor to me. Yes, almost a year. I'm so excited. Before then, in my past 3 years before then, I was in Dublin, Ireland, where I got my full level 4 laser and light therapy certificates and diplomas, as well as my Sedesco diploma, to be able to treat in 54 different countries worldwide. I am still pending in terms of being trained in full oncology aesthetics, although Jackie has taught me a lot just in-house, and I'm very happy to treat oncology patients that come in the door. On a personal note, my mom was diagnosed with triple-negative stage 3B breast cancer last year, so I have a very hands-on approach to oncology aesthetics, and I definitely understand what you guys are going through, since I've been in the on the patient's receiving end of seeing the journey and the treatment that you guys go through. So that's especially what we're going to be talking about today, is during your cancer journey of what you're going to be experiencing. So Jackie's going to start with the first kind of treatment option that we're going to talk about today. We broke it up in 4 different main treatment options, and the first one is going to be talking about if you just recently got diagnosed and you're starting your breast cancer journey, and all that you need is chemotherapy.
So with chemotherapy can come a bunch of good and unfortunately some side effects as well. We know that chemo doesn't only kill the bad cells, but unfortunately can also havoc the good ones as well. So with that said, what we do see is on the skin level, skin irritations from rashes, dryness to the oil production. That is a big one that I feel like we see, that the sebum levels in the skin just rise, and can cause people that have never had acne all of a sudden will have it from the chemo.
And their skin can become very sensitized, versus if you never had sensitive skin beforehand, even going hand in hand with that acne that you were talking about, someone who's acneic, all of a sudden they can even get sensitized rosacea underneath the acne. So that's even more aggravated.
And that's a good segue to why, which we talked about last week, why the skin barrier function and and getting that leveled is so important. So during that journey and during the chemo, we want to focus on keeping that skin barrier function intact, but it's good to always start prior to that. And that's where Emma and I come in and talk about the certain products that you can use to keep that skin strong. One of the other things that we see also is change in pigment, and that goes from anywhere to in the fingernails to the gums, to just externally on the skin, body, face.
Well, my mom had all of the above of what you've been talking about, and she had 16 sessions, so that kind of gives you a gauge in terms of what you can expect. But another thing that I thought was very interesting, again, kind of going back to my mom, since she was the prime contact of what I saw throughout the journey, is I noticed during her chemotherapy, or the type of drugs she was taking, the hair follicle in our skin is directly connected to our oil gland activity, and the reasoning that she was so dehydrated is because she actually had loss of hair. So she had completely lost hair, not just on her scalp, but on the rest of her body. That, along with losing that vellus, that downy hair, we've lost a lot of protection on our outermost layer of our skin. And so that's why a little bit later, when we talk about the face in particular, we'll get into antioxidants and why they're so important during this time of chemo and or radiation, because we've lost a lot of that initial protective barrier, like the lipidic barrier function you were talking about. So it all kind of synergistically plays a part.
Yeah, and Emma and I are here to help you through that and make it more comfortable during that process.
I think the next thing we're going to touch on, just to finish up this treatment option, one of our products here in-house that we keep for patients going through chemotherapy and seeing body changes in terms of that dehydration we were talking about earlier, is the IS Clinical Body Complex.
Love it.
We love it. It's one of our favorites. Jackie, can you talk a little bit about it and what the benefits are in the long-term use of this product?
So the body complex is loaded with humectants, which is hold in that hydration into your skin, antioxidants, which protect against free radical damage, and just overall the soothing effect that it has. You don't need much of it. It's thin in nature and it just spreads really nicely. And the softness that I feel from it all day long. So I've never had anything but positive things. No complaints. So
awesome.
Yes.
That's awesome.
Next, we're going to talk about the second treatment option during their cancer journey, which would be radiation only.
So if you just got diagnosed with breast cancer and your breast surgeon said that you'll most likely need to do some sort of oncoplasty with breast reduction for symmetry purposes, most likely you will need some form of radiation after your treatment. And radiation is essentially localized lasering around where the tumor was to eradicate the tumor and make sure there's no more cancer cells in that area, fingers crossed. So skin-wise, what happens locally on the breast tissue is we can see a lot of radiation dermatitis, which causes itchiness, flakiness, dryness on the skin. It can become very red in appearance. I'll show some pictures now of what that looks like. You can also get up to stage or grade 3 degree burns due to radiation, depending on the depth of the tumor or the cells in the area that they need to get. Sometimes if it's behind the nipple areolar complex, they have to go a little bit deeper. I found that out. Another thing that you can also see with radiation is huge discoloring in general. And what I mean by discoloring, not necessarily the redness, but pigment darkening of the area. So something that
which is because inflammation equals
hyperpigmentation, which I was just going to get into. So hyper meaning more so, and pigmentation is our melanocyte cells, our pigment cells. And when we overproduce pigment cells in our body, they come up to the superficial layers of the skin, and it's visibly darker than the rest of our natural coloring. Even with olive tone skin tones or our skin type 5s, our African American, you will still see a darker skin tone other than your original skin tone. So it's very important to note that. What we try and do here in the clinic is use a couple topical treatments to either eradicate or prevent against all of these things happening. And one of our most popular ones that we mentioned in week 1 was called Strata XRT. It's from the Strata Farm family. It's a medical grade company that specializes in innovative wound healing ointments, such as for scars, but for this particular one, it's for radiation dermatitis and burns. It's an innovative wound healing ointment that you put on the area about once daily or twice daily, depending on what your radiation oncologist wants you to do during your radiation treatment. And like we said earlier, all we're trying to do is create a really, really thick, plush, hydrated protective barrier against the laser and your skin. So you're not left with those long-term effects from the radiation. If you don't use something like this, or prevent at least 80 to 85% with a topical ointment like our XRT for radiation, unfortunately, majority of these complications that come with radiation can be permanent.
And you go ahead and be proactive with it and treat the skin prior to the trauma that's going to be done to it. it's just overall going to respond better to the trauma. So
exactly. So now we're going to talk about our second product in our second treatment option category. I talked about the Strata XRT, and now Jackie's going to touch on our IS Clinical Polyvitamin Serum.
I love the way you say that, vitamin.
Vitamin? I know, it's such a European way of saying it, guys, just FYI. So my question, Jackie, is would this help with the tightness that patients feel after radiation and the pulling that they get due to the laser?
Yeah, no, this is perfect for it because it's going to help. The skin is very compromised from the radiation, but it also will help strengthen the skin prior to the radiation. So using it prior to the radiation, if you have time to plan for that, will actually help with the tightness and the pulling, that you could have less of that effect from the radiation.
The third treatment option during your cancer journeys that we're going to be touching on is one that has an unfortunate reality with many women outside here, and that is having a combination treatment of chemotherapy and radiation, both of which we were talking about earlier. So Jackie's going to start recapping us a little bit about what we talked earlier about chemotherapy.
Sure. So what we see with a lot of the chemo drugs, unfortunately, is the rashes. I feel like that's one thing that we should talk about mostly, because that's, I mean, I know you're going to touch on a couple things, but the rashes is something we see mainly in the hand too often. Most commonly, I feel like in the hand and feet syndrome, that it just can be very debilitating at times. I've seen it where it just gets very compromised and cracky and blistery and just very irritating. We have different options that we can touch on, from ointments to just calming agents to help with the rashes.
Exactly. In terms of radiation, like we were just talking about, again, it's more localized, but it has to do with more of pigmentary changes to the area. So not only with radiation will you see pigmentary changes, but sometimes even with some chemotherapy drugs, such as the taxanes or Taxol, you could see pigmentary changes along anywhere, along the legs, along the arms, sometimes the back. I remember for some reason my mom in particular had a little bit of some pigmentary changes just in between the sternum here, which had nothing to do with the breast pocket. So it can literally go anywhere around the body. You'll also see a lot of what we call Bose lines come up on the nails, little lines, crevices, and again, it's because that barrier function, literally all of this is because the barrier function of the skin is thrown so off kilter that it doesn't know what to do with itself because it's so traumatized. The good news is we are going to be touching on a few extra products that we haven't talked about yet in regards to our Skin Better line as well as IS Clinical that are really going to help the face in particular with the symptoms that we've just been talking about with the chemotherapy. So Jackie can start with the first one.
Sure.
Why don't we talk about prevention and correction first?
Sure. So our favorite is the antioxidants. We have two different ones we use. Alto is 19 different antioxidants.
A lot.
What the antioxidants do is protect against free radical damage. So this is good for preventative, you know, if you know you're going into chemo, but also during the chemo treatment. Obviously, keep in touch with Emma and myself, and we'll let you know as long as the skin is acting accordingly, there's no reason to get off antioxidants. ProHeal is a vitamin C based serum that also has some mushroom extract and olive leaf extract, which can be very soothing. They both are
powerhouses.
Yes.
So our next product that we have is our Shield Recovery Balm. And our Shield Recovery Balm is basically similar to the XRT in the sense of creating a nice, healthy, creamy barrier over the skin and protecting it, mainly for hydration purposes, I think. It contains glycerin, which is a sugar molecule to create hydration in the skin, as well as creating a humectant feeling to the skin, so attracting water to the skin. So this one's mainly for dehydrated, lackluster skin that you would get typically from the chemotherapy.
Yep, and it's an antimicrobial too.
Exactly.
So it will help, it will protect against any bacteria.
And Jackie can discuss our last one that we have. This is our Eclipse SPF 50 from IS.
So Emma and I are big believers, obviously in SPF as a whole, but really focusing on having your SPF be a physical block. Physical blocks means it's either going to be zinc and titanium together, titanium dioxide together, or by itself. This one is both, having a higher percentage zinc, and that's typically what you find because the titanium leaves a little more of that white hue. So,
and what did you tell me about zinc the other day when you were doing my peel? As soon as I started getting a little bit of frosting or coagulation of oil on my skin, and I started feeling a little bit almost like a burn almost.
Yeah.
What did you put on it?
I put zinc oxide because unfortunately when, I couldn't stop the chemical burn, but the zinc oxide has a very calming, it has a very calming nature to it, and it does help just calm the skin.
Sometimes our skin becomes paper thin. So not only do we lose that superficial barrier that we've just been honing in on and talking about, but the actual thickness of the skin, because we lose so much of that collagen elastin in our dermis, it actually shrinks. So our skin might have been this thick, and now it's like this thick now after chemotherapy.
So focus on finding something zinc based.
Awesome. And with all of these products, we do monthly facials for our oncology patients, and we so encourage you to come in. It's a little treat to you while you're going, even during chemotherapy. We can treat you. I know there's a lot of radiation oncologists or chemotherapy doctors that are out there, or your breast surgeon that often say, nope, you guys can't do any beauty treatments, go cut your hair off today, that kind of stuff, depending on what drugs you're going on. I know my mom was in that scenario, but when I came here and you told me, no, there's options that these patients can do because we have the right ingredients and the right products that are safe to use on these oncology patients, it's such a breakthrough. So we really encourage you guys, please feel free to reach out to us. We'll leave our links and our emails down below right here for you if you want to reach out for even a skin consultation. It doesn't matter if it's your first chemotherapy session or your last chemotherapy session. We still want to see you in office and get your skin the best that it can be.
We also help you financially. We love to, we give you 10% off of products and 15% off of any facials with MNI. So our fourth and last treatment option that we're going to touch on during your cancer journey is surgery alone.
Yeah. And a lot of patients often fall into this category, Jackie, where they have the fortunate occurrence or diagnosis that they maybe have something called DCIS, where they just have to have surgery. So during the surgery process, of course, that is daunting in and of itself. It would be either a full mastectomy on a unilateral side or a bilateral side mastectomy, followed by a breast reconstruction by some of our wonderful plastic surgeons. So what we want to touch on is after the surgery. After the surgery, there will be some scars. And it will be not only a physical but a psychological point where you will see your body every day in the mirror after that. And sometimes women will come up to me and say, I just don't feel like myself anymore. I've heard this too often and it's horrible. I don't feel like a woman anymore. Yeah. And it's really sad to hear that. So Jackie and I have put together this awesome scar protocol for you guys, where we really want to help you physically as well as psychologically feel like yourself and get back to the best possible look of what you originally looked like.
The scars are also a reminder of what you've been through.
Exactly, yeah.
So
it's your battle wounds.
Yeah.
It's a good thing.
Yeah.
They are a good thing, and we do see them as a good thing, but some patients want to alleviate a little bit of some redness that can come up on the areas of the incision sites, as well as some hyperpigmentation.
Yeah.
That can also be caused by the controlled trauma in the area. Anytime a patient's opened up and closed back again, there is some trauma to the area of the skin. So what we go into first is using a scar ointment called Strataderm. And Strataderm is part of the Stratafarm family, similar to the Strata XRT, where we're using it on your scars for about 3 months to get the full effect. And what we're looking for is less raisedness of the scar and diffusing a lot of that redness surrounding the scar. So when your scars are healing, again, a prevention and corrective standpoint, we're making sure that you don't get excess hyperpigmentation or keloiding.
We even have a modality that we use that helps with the redness called BBL, broadband light.
Yeah, absolutely. So BBL, like Jackie just said, it stands for broadband light, and we're using pulsed light therapy to get down to the epidermal dermal junction of your skin and a little bit into the dermis to stimulate collagen and elasticity in the area. So if your skin is thinner than it used to be, it will plump it back out. It also mainly helps with hyperpigmentation. So if patients come out of their surgery with some darkening around the incision sites, we can help that to alleviate and get rid of some of that.
But to mostly diffuse the redness.
Exactly.
Right?
The main thing that we use it for is to diffuse redness on the scars themselves, because you will be left with the blood flow coming up towards a scar to repair itself. So it's a good thing, but what we try and do is speed that process up. So I think that's everything. Thank you guys so much for watching and joining us on week 2 of Breast Friends October Breast Cancer Awareness Month. Next week, week 3, we are going to be touching on
Post-cancer treatments.
this is going to be the fun one where we're talking about really fun anti-aging products and treatments of what you can really start doing in the clinic. So we're very excited about this one. All right, have a great day, guys. See you later.